Hi, my name is McKenna Haas. I'm a master's student at the University of Minnesota School of Public Health, and today I will be presenting work my colleagues and I have done regarding addressing breast cancer screening in women of African heritage in Minnesota. So in the US, women of African ancestry or African American and immigrant African women die from breast cancer at a 40% higher rate than all other racial identities. And Minnesota, like many states, continues to experience persistent disparities in timely breast cancer screening, late-stage breast cancer incidence and mortality, as well as race and ethnicity disparities in social systems and economic factors that give rise to differential downstream health outcomes. And in Minnesota, women of African heritage have an 8% higher mortality rate for breast cancer compared to non-Hispanic white women. And women of African heritage are more likely to delay breast cancer screening and be diagnosed with breast cancer at a later stage, which leads to more breast cancer death. Elevated death is also due to distrust in medical providers and language, cultural, and structural barriers. So what are we doing about it? Breast Cancer Champions, or BCC, was created from a community organization called Sisters Standing Up to Breast Cancer. And today, BCC is a peer-to-peer education program that provides breast cancer education and screening opportunities to women of African heritage in the Twin Cities area, with the overall goal of reducing barriers to screening and subsequently disparities in breast cancer mortality. And we do this through trained community health educators of African heritage, also called champions, who commit to being a recognizable source of breast cancer resources for women in their community. So how do we do this? Breast Cancer Champions is made possible not only by our amazing champions, but also with the help of multiple partners. So the University of Minnesota helps to secure funding, provide resources, and conduct research for BCC, while the Breast Cancer Education Association provides resources, training, and community connections. Additionally, SAGE is Minnesota's National Breast and Cervical Cancer Early Detection Program that assists in the cost of mammograms for uninsured and underinsured women. And finally, Park Nicollet provides their mobile mammogram van for screening events. So it's often difficult to determine the impact of a program in a community setting, though today we want to present a novel way to collect and analyze data for peer-to-peer education and screening programs. So what we did was we collected champions data through bi-weekly check-in calls from August 2020 to October 2021. And data was on the location, date, type of activity, and the number of women talked to, provided materials to, referred to screening, and screened, which all of those numbers summed together were defined as total engagement for our analysis. Additionally, SAGE's geocoded screening data was collected during the same time period and in the 15 months prior to our intervention for comparison or control. And we used the activity's geographic locations to determine the reach and area of champion activity, which fell across 3 different counties. And the parts of those counties that didn't fall within the within the area of champion activity were used as a control. And the image on the slide shows where and how champions were active. And for contrast, a higher percentage of minority population is shown with a lighter shade. So we conducted statistical analyses to determine if our intervention increased SAGE breast cancer screening rates for our priority population of African American women in Champion's active area compared to the previous 15 months. So overall, there was a significant or meaningful increase in screening by African American women residing within the area of champion activity, whereas the rates remain stable for areas outside of champion activity. And there was also a spillover effect where screening also increased for our non-priority populations. So overall, thanks to so many people making this possible, Breast Cancer Champions is having a positive impact on women of African heritage in the Twin Cities, and we hope to keep doing this great work. So thank you for giving us the opportunity to spread the word. Thank you.